Welcome to Counselor's video channel. In this episode, Drug Education Part 9, we're going to talk about how drugs move around in the body and how they do what they do when they get there. This includes pharmacokinetics, pharmacodynamics, a little bit about side effects versus allergies, and some information about both effective doses and lethal doses. Pharmacokinetics is the study of how drugs move around through the body and in the body. There are a number of things that affect this. One is drug dose. One is routes of administration, which we talked about in a past video. Also important is drug absorption. Some drugs are readily absorbed and others pass through the body without being digested and absorbed into the bloodstream. There's biotransformability or bioavailability. Even though the drug's in the bloodstream, can it react? And there's the question of drug distribution, how it gets where it should be going, as well as drug elimination, how are drugs finally removed from the body. In this video, we're also going to look at pharmacodynamics. How do drugs do what they do? One factor is the dose effect curve. As doses change, the effects do not always change in an equal amount. We need to know what's the effective dose, how much of a drug will it take to do something. But it's also important to consider that many drugs have a lethal dose. Above a certain amount, the drug can be fatal. For example, alcohol requires a minimum amount before you begin to feel any effects. But at high enough levels in the bloodstream, alcohol can be fatal. We'll also talk a little bit about the subject of drug interactions. When are drugs in combination going to have a different effect than when taken individually? Pharmacokinetics is the branch of pharmacology that concerns itself with absorption, distribution, biotransformation, and excretion of drugs. The absorption is how do they get in the blood, the distribution, how they get to the site of action, metabolism, the process of breakdown. All of these are affected by the way the drug enters the body. And how does the drug dissolve? Some drugs are highly soluble in water. Others are highly soluble in fat. And some drugs have a mixed solubility. Other factors of each individual drug that may be important are bioavailability, can the human body use it, and diffusion rates, how rapidly the drug moves through the body. It's also important for each individual drug to know how the drug is excreted or eliminated from the body. When we look at pain relievers, for example, we can see that some are metabolized in the liver and others in the kidney. Too much of a drug that's metabolized in the liver can damage your liver, while too much of a drug that's metabolized in the kidney can damage your kidney. drug absorption and bioavailability. Absorption is how fast it leaves the site of action. Bioavailability, the portion of the original drug dose that reaches the site of action or is dissolved in fluid to get there. Some compounds dissolve easily and others go through the body largely undigested. This characteristic of the drug will affect the drug using experience. For more information, please visit the Counselorssoapbox.com blog, where you will find articles on mental health, substance abuse, and having a happy life. The David Joel Miller fiction and nonfiction books are available on Amazon.